Hi friends, welcome back to my channel. If you're new here, my name is Shelby and I'm so glad you clicked on today's video. So I left you guys, I guess, with two videos. The first one was talking about how I was really struggling with my anxiety and kind of mental health. And the second one was right before we saw the cardiologist and had the fetal echocardiogram to find out what was going on with our baby's heart. A lot has happened since then. I've taken my time to really process things and get to a point where I'm comfortable to talk about it, and that did not happen overnight. In regards to my mental health and that whole situation, I did seek help and start talking to someone. I can honestly say I'm doing so much better. I've been working on cognitive behavioral therapy. It is so weird to have had such a healthy pregnancy and felt so good the whole time to now be in this high-risk pregnancy category. I kind of just expected that I would get pregnant, have my baby, and just go about it like everyone else does that I see on the internet and social media. I had no idea that we would be faced with these things or, you know, be in this situation at all. You saw the previous videos where I was kind of struggling, and you're going to see this one where I seem to be doing great. But there's a huge in-between chunk. It was really not okay, and I was not okay. And during that time, I didn't share a whole lot, but I did write. Just getting all of my feelings and emotions out, that really helped me to cope. So I do have a blog post. It's called Finding Out Your Child Has a Congenital Heart Defect. And although it's live on my website, I did not really share it with anyone other than my immediate family and friends, because I wanted them to kind of understand a little bit more how I was feeling. I will warn you, this blog post is kind of dark. It's very raw and real, and these were my emotions and how I felt in that moment. But now I'm doing a whole lot better and I'm seeing things in a different light. But at that point, all that I knew about our baby felt like it had something wrong with its heart, and I couldn't see past that. But I can now, after a couple more appointments and talking to the cardiologist and just getting reassurance about everything and understanding the diagnosis a whole lot better. There is a bit of a bright side if you give that a read. I will link that down below for you guys as well. Okay, in regards to the cardiologist appointment and that whole situation, if you read the blog post, you're gonna kind of get caught up as to what happened there. So we had our appointment where we got a diagnosis and met the pediatric cardiologist and maternal fetal medicine and had the fetal echocardiogram. That was all the beginning of October. So that was a very heavy day for us. Basically, it was 9 hours of appointments, the baby's kicking me, and just being at the hospital where it was appointment after appointment and information after information. It was one of the hardest days of my entire life, and it was a lot. Anyways, I'm not going to get into all of that. You can read the blog post if you want to know exactly how I felt, but I'm going to get into the notes I took from that day, from that appointment. So we found out that overall the baby grew and developed perfectly since the previous appointment. At this point, the baby was up to 2 pounds, 14 ounces in the 69th percentile. Currently, I'm 34 weeks today, and the baby is probably close to 5 pounds because a few weeks ago they were just over 4. So probably getting close to 5 now. At this appointment, we also found out blood is still flowing as it should throughout the heart, but there is still a valve issue. So that is still the case. I had another maternal fetal medicine appointment since then, and same thing, they kind of checked everything out again. There has been no changes. Everything is still consistent with the last time, so nothing has gotten more severe or critical, so that is a good thing. So we had the fetal echo, and then we met with the pediatric cardiologist. He went over everything. He explained the structures of a normal heart, how everything works and flows, and gave us a diagram of our baby's heart and explained what's going on. Wow, just talking about this really brings me back to sitting there and how I was feeling. He was really sweet and detailed, gave us many scenarios and explanations, and worst case scenarios as well. So he said that the baby has something called Schones Complex, which is a very rare heart defect. So I looked this up, and honestly, don't look it up because it's so rare. It's only like 0.5 or 0.6% of the whole congenital heart defect realm. But the reason that I say don't look it up is because Schones Complex is an umbrella term, and basically there are two types, but then there are so many subtypes. There's complete Schones, which means you have every defect that could happen on the left side of the heart. And then there's incomplete Schones, which is what our baby has, which is just a few of the defects on the left side of the heart. But basically, Schones is the umbrella term for multiple left-sided defects. The reason I say don't look it up is because every individual case is so different. Some people have a lot of surgeries, depending on what those defects are. And some people go their whole lives with maybe just being monitored and having a surgery when they're an adult because things aren't critical. He also told us that the kids that he has seen that had this condition had really great outcomes. So there were a few different defects and scenarios that he mentioned to us. At the time, my husband understood everything so much better than I did because he was used to having those cardiology appointments for his own heart and kind of just already understood the structures, whereas I didn't. And I just kind of shut down and wasn't able to take anything in. There were a couple different things that the cardiologist saw within the baby's heart, but I asked him a few weeks later because I had time to process everything, and in the moment I just couldn't. And I asked, of the possible defects that you saw, which one is the most critical or severe? And he told me at that time, this baby's heart defect was not critical, so that's good. That's really good. And the most severe of the possible defects that he saw was aortic stenosis. So that means that there is narrowing near the aortic valve. And that is because the aortic valve is dysplastic. So when I mentioned before about the echogenic focus ended up being on the aortic valve, which means it's calcified, so it's a bit thicker, so it doesn't function as freely as it could. So sometimes it gets a little bit stuck and blood goes through there a little bit quicker. The stenosis right now is mild to moderate, and it stayed consistently mild to moderate, which is really good. If it was severe or critical, that would mean intervention would need to be done right away. So as of now, where we know it's mild to moderate, it could stay like that for years. It could stay like that until this child is maybe 5 or 10 or until they're 50. We don't really know. That's what's hard when it comes to the uncertainty, is that every case is so different. That all babies are born with something called a PDA, paternus ductus arteriosus, I believe it is. I could be totally wrong on that pronunciation, but I think it's close. So all babies are born with this, and it allows blood to bypass a part of the heart since the lungs aren't functioning yet. After babies are born, that PDA typically closes within a few days or a few weeks once they start breathing air, because it's not needed anymore now that the baby is taking in their own oxygen through their lungs and they don't need it through the placenta. That is going to be monitored right after birth, because there's one thing that could possibly happen that the baby does not have right now, but they're going to be watching to make sure that it doesn't happen, and that's coarctation of the aorta. So as of now, we don't have it. Fingers crossed it stays that way. If the PDA closes and the coarc does not happen, there is a chance that the aortic stenosis can be manageable and fine, and that maybe no intervention will be needed at all. There is also a chance that there could be no coarc, but maybe the aortic stenosis does need some intervention, and in that case they would do the balloon valvoplasty procedure, which is like a small incision in the groin, and they put a catheter up there and a balloon kind of opens up the stenosis or opens up the valve so that blood can go through easier. The chances of death from that type of procedure, the cardiologist told me, is 0. No baby has ever died from a catheter procedure, so that's good. But there is a chance that if the baby's PDA closes and a coarc does happen, that they would need surgery. So that part and that level of unknown is tough. I'm doing better with it now because I know that I can't control it and I only need to focus on what I can control today and what I know today. And so I'm trying not to dwell on that because, like I said, there is no coarc right now. But if it does happen, there's a chance that they will have to fix the aorta so the blood can flow through so that growth and those things aren't affected. He also explained that we didn't do anything, I didn't do anything wrong, Devin didn't do anything for this to happen. It's kind of a totally random thing. So congenital heart defects happen to 1 in 80 to 100 pregnancies or children, and congenital just basically means that you're born with it. Long term, we know that this child can have a normal life. They can even still play sports, but they will be followed by a cardiologist to monitor changes, just kind of like how Devin was. The hardest part for me has been the uncertainty surrounding everything, because although we know what the situation is, which is great because we can make sure we have the right team and we're in the right hospital, there is still uncertainty until the baby is born and they can do an echo on the baby. So until that happens, there's a lot of uncertainty, whereas we don't know exactly what things will look like. That has been the hardest thing for me to cope with and one of the biggest things that I've been working on. So everything is going to depend on how this baby does when they come out. So we're hoping that when this baby comes out, he or she is able to breathe on their own. They're not blue. They're able to, cry and move around, and as they described it, just have vigor and life and not need immediate supports. So we will be relocating to be near the IWK to have this baby. And at first I was very overwhelmed by this, and now I just kind of feel like I know that we're going to be in the right place with the right doctors and specialists and nurses who are going to take really great care of us and who care. So we're going to be relocating right after Christmas to Halifax to kind of wait for this baby to be ready to come into the world. Or there's a possibility that I could be induced around 39 weeks. And that is because as you get closer to 40 weeks or even past your due date, there's other complications that can arise. So that could mean your placenta could start to deteriorate. The amniotic fluid could also start to get lower. And of course, the further past your due date you go, the chances of a stillbirth increases. And overall, they just don't want me to go overdue and anything to happen that could put any extra stress on the baby, which is understandable. After the baby is born, we'll have some time with them, and then they will go to the PICU for the echocardiogram, and I will be in postpartum recovery. This part has been really hard for me because, of course, right after you have your baby, you want to have that time with them, that skin to skin, and just that bonding moment. And I did talk to the neonatal doctor a few weeks ago, and I really put everything out there. I had a list of questions on my phone, went through it all. She was amazing. As long as this baby comes out breathing, crying, they're not blue, I will still get to have that time with them before they go to the PICU to be evaluated. And when they do go to the PICU, Devin can go with the baby and stay with the baby the whole time. I also asked at my last appointment what the difference was between the NICU and the PICU. I know that PICU is pediatric, but NICU is neonatal. It's specifically babies. And the neonatal doctor told me that these two units are right next to each other at the IWK. The only real difference is that any babies with suspected cardiac issues go to the PICU first because they have better monitoring systems. There is still a chance that, and this is again where all the uncertainty comes in, that the baby might not need much time in the PICU because they could monitor the heart and they could see that, okay, this isn't as severe as we thought. We're going to go to the step down, which would be the NICU. Also, one of the good things is that the IWK just renovated all of their NICU and PICU floor or ward. So they have parent rooms attached now to the patient rooms. So Devin and I will both get to stay there with the baby as long as COVID doesn't change anything. As of right now, a pediatric patient is allowed 2 support people, which I really hope that it stays like that. She told me they want things to remain that way because it's just better for the family dynamic. It's easier on people. But what could happen because of COVID is that neither one of us will be able to leave once we're in the PICU with the baby. We will have to stay until we're discharged or we can't come back. So that's a small price to pay. I think we can handle that. Again, we'll have our own room there, our own bathroom and showers. They'll have laundry facilities for us, and I know the IWK has a way better food situation compared to my local hospital. So that's a little bit of a positive. I am back home in Cape Breton now after my last appointment, which was the end of November. So at that appointment, the fetal medicine doctor thought that everything still looked good. There were no changes with the heart. Again, that is wonderful. That's what we want to see. So until we relocate to Halifax to wait for this baby to arrive or to be induced, I have weekly biophysical profile ultrasounds at my local hospital. So what that is it's a 30-minute ultrasound, and it's kind of like a test for the baby where the baby gets a score. I had my first biophysical profile ultrasound, oh, you're so cute, last Friday, and the baby scored 100, which was great. And I have my next one tomorrow actually, and I'm gonna have these weekly up until we relocate to Halifax, and then I assume they're going to do the same thing up until maybe they decide to induce or if this baby comes on their own. So ultimately, to end this video on a brighter note, I am doing a whole lot better than I have been mentally. Physically, I still feel pretty good. I'm very sore all the time. There's a lot of pressure. The baby is quite large now and I can feel it. There's feet in my ribs all the time. They're still head down, which is good. So everything's looking good that way. I know that overall this baby's gonna have a normal life. They can play sports if they want to. They can do all the regular things that kids get to do. There's just going to be that added aspect of cardiology appointments and checkups to make sure that things are okay. But that's a small price to pay. I know that some people get heart defect diagnoses that are way more critical than this one. And my heart goes out to anyone who has. I know that sometimes people find out that as soon as their baby's born, they're going to need surgery. And in our case, we don't know that this baby will need surgery right away. It's just, we know that there is something, they found it, they're watching it, they're monitoring it, and we're gonna just deal with whatever happens when it happens. And I'm trying not to overthink and not to worry about anything out of my control, because I know that ultimately that does not help me. I hope that this kind of clears up what's been going on. If you've been worried about me because I haven't been posting, I am doing a whole lot better. The baby is doing well and things are going to be okay. They're just going to look a little bit different than we thought in terms of relocating 5 hours away during a pandemic to have our baby at a different hospital. But hey, we can tell this kid some pretty crazy stories someday. Thank you to everyone who has sent me so much love and support. It really means so much to me. Thanks for watching, you guys. Have an awesome day, and I'll see you next time. Bye.